What are the mistakes that we shouldn't do during periods days? You don't wash your hands at the right times. If you're like most people, you wash your hands after inserting your tampon or changing your sanitary pad. But why aren't you cleaning those hands before you do those actions? It's important to keep hands clean to protect your vagina from all the bacteria that you encounter throughout the day. So, if you'll be doing anything down there, wash your hands before doing so. You don't change your tampons or pads enough. To prevent leakages, change your sanitary protection every few hours. Depending on your flow, check pads every 2 to 4 hours. Using the lowest absorbency tampon, switch your tampon at least every 4 to 8 hours. Doing so will help reduce the risk of toxic shock syndrome, a rare but life-threatening complication of certain types of bacterial infections. It's often associated with the use of superabsorbent tampons. The incidence of toxic shock syndrome has declined since manufacturers have taken certain types of tampons off the market. You don't get enough iron. Do you yearn for a hamburger during that time of the month? That's because your body is craving iron. It's common to be low on iron during your period, because you're losing iron-rich blood. Iron helps carry oxygen through your body, which gives your body the energy it needs. So, replenish those iron levels by consuming beans, red meats, dried apricots, oysters or spinach, or take supplements. If these tricks don't help, speak with your healthcare provider. You may need to be tested for anemia, a condition that develops when your blood lacks enough healthy red blood cells. You don't track your period. Charting your cycle isn't just for women who are trying to conceive. By tracking your period and the heaviness of your flow and your pain level, you can talk with your healthcare provider about what's going on, and you'll have a better sense of what to expect physically and emotionally from week to week. Many apps are available to make the process easier for you. You don't get enough rest. When you have your period, your body is working overtime, and it needs a break in the form of sleep. Otherwise, you'll be more anxious, crankier and prone to eating junk. So, don't be a hero and push through the pain. Instead, practice good sleep habits to help with your overall productivity and health. You don't proactively take pain relievers. If you wait until you're doubled over with cramps to take your meds, those pain relievers will be less effective than if you take them before the cramps hit you. Pain is easier to prevent when it's mild or before it starts as opposed to when it's debilitating. So, if your cycles are predictable and regular, take an anti-inflammatory drug 1 to 2 days before you expect your period to help prevent cramping. If they're irregular, take a pain reliever as soon as you experience any bleeding or cramping. You don't look at the color of your blood. The color and texture of your menstrual blood are important. You want blood that is bright red, with occasional clotting being normal. Dark colors are normal too, because that's older blood that took longer to come out. But, contact your healthcare provider if you see blood with an orange tint or orange with red streaks. These colors mean fluids from the cervix are mixed in there, and you may be battling an infection. And reach out if you have heavy clots more often than not. Thank you for watching this video. Please like, share and subscribe for getting more health tips.